Have you been told your thyroid tests are normal, but you still feel horrible and you want to get help? Right now, during this global pandemic of COVID-19, now is not the time to keep going from doctor to doctor just to be told that there's nothing wrong with you. Especially with coronavirus going around right now, you cannot afford to have your symptoms ignored because it could be a matter of life and death. Hi, I'm Dr. Jessica Conwin, and I'm the Doctor of Pharmacy and Thyroid Specialist here at Bethel Holistic Clinic. And this is the phrase that I hear all the time. My thyroid tests are normal, but I still feel horrible. These symptoms that are causing you to feel horrible can actually put you at an increased risk of getting coronavirus. Let me explain. If you're somebody who has symptoms such as weight gain or inability to lose weight, like no matter how low cal you go, no matter how much you exercise, the pounds just keep piling on. Or you have chronic fatigue where you can sleep 10 hours and then you wake up and you feel like you can sleep another 10 hours. You never have restorative sleep. Or you have brain fog where you have inability to concentrate, you feel like you have ADHD, you have memory lapses and memory loss to the point that you feel like you have early onset Alzheimer's. If you have any of these symptoms, it's a good sign that you could have hypothyroidism, which is low thyroid function, and it's such a big miss in traditional medicine. And so people will go to their doctors and complain of these symptoms. They order the test, and then the doctor can come back and say, oh, it's all normal. There's nothing wrong with you. But you feel horrible. This is a sign that there's something wrong. You can't have normal lab work and still feel bad. And it happens all the time in traditional medicine. One of the reasons why this happens is that the right tests aren't ordered, or even if the right tests get ordered, then they're not analyzed correctly. And there's many more symptoms of hypothyroidism, such as hair loss. Some people are losing their hair, it's coming out in clumps. Or you could have skin issues where your skin is constantly dry, it's flaking, it's itchy, you keep reacting to things in your environment, so you get hives and rashes really easily. You could have mood issues such as mood swings, irritability, anxiety, depression. You can have symptoms like your temperature, like your body temperature. You're always cold, like you wearing a jacket and socks and it's 100 degrees outside and it's summertime. Or you have symptoms like digestive issues where you have chronic constipation, bloating, gas, always feeling full, acid reflux. All of these could be thyroid symptoms, right? Then you have other symptoms such as menstrual irregularities where you can have an abnormally heavy menstrual flow. Like when you menstruate, it's like a faucet is turned on. Not to be too graphic, but that's how it is for some women. Or you can have miscarriages or inability to conceive. Also things with like your muscles. You can have muscle pains and joint pains. All of these things could be signs that you have a low functioning thyroid or hypothyroidism. And the reason why this is so important is because 90 to 97% of people who have the symptoms that I just listed will have chronic underlying inflammation in their body. The reason why this is so important to you is because coronavirus is binding to the damaged sites in our bodies, the damaged sites that are coming from chronic underlying inflammation. The reason why I keep stressing underlying is because it's not visible. You can't see it from the outside. It's internal inflammation. And so these symptoms are pointing to a sign that there could be this chronic inflammation in the body. And this is what coronavirus wants to bind to. And the more binding sites that it has available in the body is the more that the virus can get in the body and infect the person and make them very sick. So somebody with chronic underlying inflammation, and a lot of that inflammation can actually be at an increased risk of getting the coronavirus. And not only that, but they can also, if they get the coronavirus, they will become much sicker and the progression of the disease will be much worse in that individual. So that's why I'm saying to you, this is not the time to keep having your symptoms ignored. If you're going from doctor to doctor and they keep running tests and saying that there's nothing wrong with you and you have these symptoms that I just listed, You have got to get help, and now is the time. This is literally, like I said, could be a matter of life and death for you. And this is why I'm offering the one-on-one consultation with myself, so that I can partner with you and your doctor so that we can get to the root cause of your issues, so that you don't keep having all of these symptoms. And that also, not only are we able to reverse these symptoms, but we're able to make your body more healthy and resilient to viruses and bacteria and diseases overall. That I want you to be healthier so that you can function in your normal day-to-day life and stop feeling horrible. So now is the time. Do not delay. Click the book now button so that me and you can get started to making you a healthier you. Thank you for listening. Bye.